tonight will be enlightening on this topic. Hopefully, we'll come up with some practical solutions on what we all can do to help address this necessary need. Dr. Blunt?
I'd like to enter into that question about food justice by telling a quick story. I began learning about being exposed to and also being somewhat of an activist around this during a period of burnout, church burnout. I was at a point where I was thinking that the congregation that I was currently serving, I had run my course. I had done all that I could do and was looking for another opportunity. Well, I'm part of the African Methodist Episcopal Church, and for that other opportunity to present itself meant that the bishop would have to move me. And for whatever reason, during that time, God saw fit for the bishop not to move me. And so I then had to ask God, all right, God, if I'm to stay here, then you need to open my eyes to what it is that you want me to do next. And in just saying that prayer, my eyes became open. I looked around where my congregation was located. It sits between two public housing projects. So I got to really take into consideration my context. And then all of this information started flooding in as to issues related to food deserts. And so I hear your understanding. I know I agree with your definition around food deserts. But at that time, that's how people were characterizing the situation. And I said, wow, what would it mean for us to have a free farmers market so that the people of our community would be able to have access to fresh fruit and vegetables, because there was no supermarket in the entire city where I was pastoring. What I also found out was that the food insecurity is directly correlated to chronic health issues. And so the issue becomes, as well as then learning from the World Health Organization, that 49% of chronic illnesses can be alleviated through healthy diet and exercise.
Absolutely.
So the question was then, what role can our congregation play in being able to help speak to these issues of food insecurity as well as health disparities? And we began a journey in beginning to help to address that work, which included partnering with other faith communities in putting together a summer free farmers market, where every week we would serve about 170 families, providing fresh fruit and vegetables and other nutritious food to help aid the food insecurity crisis. That some of that work now continues in the congregation that I'm serving now at Arnett Chapel. And we have as one of our guests, Reverend Dr. Valerie Parker, who has helped to make some of that happen, but I'll let her introduce herself and the work that she does. But we want to open it up to the rest of you. How are you defining the issue of food justice?
Let's start with Dr. Parker.
Thank you so much, Reverend Dr. Cynthia, and to the panelists. Welcome. Thank you, Dr. Blunt, who I co-labor with at Arnett Chapel. In my work at the Greater Chicago Food Depository, food justice is really informed by, especially as of late, racial equity, or shall we say racial inequities. And so when we think about racial equity, we think about the fact that, and this is a part of our mission, no one should go hungry. That's food justice. There is no reason why in such a land of plenty, anyone should go hungry. And so the work that we do to inform food justice is really, it's a two-pronged mission, feeding the hungry while striving to end hunger. So it's not enough just to provide healthy meals in the form of congregate meals, food pop-up distributions as we do every Wednesday from 1 to 3 through August 26 at Arnett Chapel. But what we need to also do is think about communities and use data to help understand where the communities where there is lack. How do people get the food if they don't have the ability, such as our seniors or those who are homebound by illness? How do they get the food? So we come up with strategies to determine how we get the food to people, but then we ask the question over here, why are they hungry? And then begin to address systemic policy issues that are usually driven by racial inequities. And then when we begin to unpack that, then we can move closer to what we believe food justice is, which is no one should go hungry. In our team meetings, we talk often about the fact that we should be out of work. There should be no food banks. We should all be out of work because the food is plentiful, the food is getting to where it's supposed to be, and it's nutritious. I think Reverend Dr. Cynthia used that word, nutritious. And so we're very careful also about making sure, to Dr. Blunt's point, that the food that we share with our community is nutritious. Fruits and vegetables, meat, dairy products, not chips, not soda, and holding accountable our partners such as grocery store chains, donors who want to provide food for us to share with the community. Let them know that food justice also means healthy eating, so that the systemic health concerns that we have because of poor diets is minimized. So that's a long, circuitous way to just say food justice is about no one should go hungry, and that we should really be striving to end this whole notion of talking about why people in one of the wealthiest nations in the world still go to bed every single night without a meal.
Thank you very much. And we talk about these health issues, diabetes, high cholesterol, high blood pressure, and people actually are dying, where in other communities, this is stuff that can be definitely impacted by how you eat and what you eat. Dr. Regina Thomas, what does food justice mean to you?
Gonna have to take mute off. There you go.
Unmute myself. I am sitting between a couple of devices, and I am currently in Kentucky, and it's storming. So that we having some difficulties. I agree with Dr. Parker. Food injustice is the fact that any child or any person that goes to sleep at night and is hungry, it is just a basic fact that there is not enough food, and not just food, but as you said, Dr. Cynthia, nutritious food for children to eat. I work for the American Federation of Teachers, and we have spent time to ensure that as schools begin to open, and even in the summers they're closed, that there is a guarantee that those students that are part of the food and nutrition program continue to eat, whether they are in school buildings or working or studying remotely. And so we understand that if a child is adequately fed, then that enhances the child's opportunity to learn and pay attention and do all of those things. And so I think it's imperative in this country, who is so rich in so many things, that we continue to push, particularly as faith leaders. I was talking to a couple of staff the other day as we are trying to deal with this food and nutrition program in a safe way and making sure that our bus drivers and everybody is safe. We learned that on every corner in our community, there is a church and there is a liquor store. And perhaps maybe the liquor stores should work with the churches, or vice versa, the churches ought to work with the liquor stores. Now, I know that sounds a little crazy for those of you out here that just think Jesus ain't up in this situation. But the reality, if liquor and wine can get to our neighborhoods in abundance, absolutely, and it's part of a program when you governors is around this country trying to make sure that restaurants and all of these places stay open, that is inclusive to them, then we must work very closely with those persons to make sure that they too have adequate foods in our neighborhoods and not just snacks. So it is, I know Dr. Parker was talking about, we must begin to look at every avenue. We are facing crazy times with this pandemic. And so crazy times needs crazy relationships in order to make things work. And so if we can just walk 2 doors from our church, hang out with the liquor store owner, and have a conversation with that person about how we can continue to feed these children. So the gist of it is, anytime a child goes home or family goes home and go to, and they are not adequately fed and hungry, that is the definition.
Amen. Amen. I'm making a note. Make a trip to the liquor store.
I'm just wondering, where is Dr. Regina? Because I think I need to get on in a car or a plane. I'm willing to do that legwork with you, Reverend.
Because it's all about partnerships, and that makes.
But I'm gonna tell you how crazy stuff is. We sit and talk about kids not getting food, not getting Wi-Fi. But if I was in prison and got out and they put a strap around a collar around my leg, and I walk a block outside of my neighborhood, somebody gonna figure that out. Right. And so why can't that same technology to be used to make sure that the Wi-Fi is in we got to do drastic, we got to do crazy.
Yes, yes.
And, you know, I go through an easy pass and I'm going 80 miles an hour. Not only am I going to get a ticket, but I owe that fine because my easy pass is going to pick up the fact that I went through an easy pass.
Right.
And so we need to have relationships with these persons that are in our community that can assist us. That's all I'm saying, Reverend Parker.
And all I'm saying, Dr. Thomas, is I'm willing to come and help you build those relationships.
And that's awesome. It's about thinking out of the box, because we are living in a time when it is necessary to think out of the box. And for any faith leader who is listening to this discussion, who's just waiting for Jesus to come back, this is ministry. You can't give Jesus to hungry people because they're just not hearing you.
Man.
Not hearing a word that you are saying. So, Pastor Kim, what does food justice mean to you?
Good evening, Reverend Jackson. I agree with the majority of the panelists. I think they summed it up pretty much, everything that I was thinking. I definitely agree that food justice for me in the definition is that everyone has access to affordable, healthy, nutritious foods in their communities. And that's those who've been previously incarcerated, regardless of the charge that they had, whether it's drug related, federal related, local related, whatever. Everyone should have access to nutritious and fresh foods in their community. And that community should have access to, as Reverend Regina was talking about, if they have a liquor store on every corner, then we need to have supermarkets in communities of those, especially the rural areas where a lot of people may live further out, may have lack of transportation, to have that access to have food where they're able to transport it back and forth to feed their families. I think that even with the policies that I believe we'll talk about later, have a lot to do with a lot of the food insecurity that takes place, because it puts restrictions on individuals who, especially in the area that I work in the Department of Health and Human Services, where they have policies that restrict individuals from getting food access, even though they may offer health insurance such as Medicaid, Medicare. But in order to, even if after they receive those services, they're not able to receive the nutrition to help them prevent getting any diseases that can be cured through getting that access to the foods.
Yeah.
Right. And even when you have supermarkets, everybody doesn't have the resources to go to the supermarket to go shopping and buy organic food produce is extremely expensive. So if you're working with limited resources, it's not as simple as going to the store. But whether it's a rural area or even in an urban area like Newark, I mean, there were no good supermarkets
Right.
until very recently, and now there's one good supermarket, but you still need resources to get there and to be able to shop there. And you have to have transportation, or you have to have somebody to take you, or because it's not in walking distance for everybody. Dr. Sidney, what does food justice mean to you?
So, food justice. I enjoy Reverend Gina every time she speaks. I will say, in terms of crazy partnerships, this summer we partnered with one of the local restaurants because the school district, we didn't have capacity in our freezers to take all the lunches that they needed to distribute. So we partnered with a restaurant. They had capacity in their freezers, and then each morning we would go and take enough lunches for the day and bring that to our church so we could distribute it. So food justice, it is about crazy partnerships. It's doing stuff we hadn't thought about doing. But the other thing I wanted to raise is this idea that food insecurity or food justice is a poor person's problem or someone who doesn't have access. Morris County is one of the wealthiest counties in the country. But what we're finding is in Morris County is that people that don't otherwise attend food pantries or soup kitchens are struggling to pay mortgages, struggling to just survive and get their medication. So it's not a black and brown issue during the pandemic, it's a human issue. And as we travel throughout the county, you know, we're seeing mostly white people who would not otherwise be coming to Bethel African Methodist Episcopal Church for food. But now in the midst of this pandemic, it's a human issue, and I think everybody sees that. But as I shared with Dr. Blunt and Dr. Cynthia, that oftentimes even our churches, you know, people like to quote the scripture, if a man doesn't work, a man doesn't eat. The assumption is that working means you can eat. And the reality is we live in a society where working doesn't necessarily mean you're gonna make enough to cover your expenses. And many of the people that we serve actually do work, do pay rent, do pay a mortgage, and try to pay a car note, and try to pay childcare, and trying to figure out how we're gonna make it through the week. And so food justice, I think, speaks to not just those who don't have access, but it's income issues. It's a quality of life issue that's so important. And then the last thing I'll say is, I saw someone in the chat mention, and I'm assuming their data is right, $12 a month for fresh produce on SNAP cards. What can you get with $12 at ShopRite or Whole Foods with $12? Not much, particularly if you're trying to feed a family. And so, you know, to even talk about nutrition and then not give enough resources to go make the purchases. $12 a month, I don't know what you could buy with $12 a month that's organic and fresh.
Nothing. is the answer.
Nothing.
It's nothing.
Yes. So y'all have already begun speaking to some of the chronic issues that we're facing to be able to address this issue of food justice. Can you begin to give some specifics as to how you are in your own particular context beginning to address? Well, again, if you want to name some more of what you think some of the chronic issues are, and how is your organization and the work that you're doing beginning to address some of that work? And we'll just go back to you, Dr. Sidney, and the work that you're doing in Morristown.
Oh, well, thank you. Again, I think, you know, we have been really trying to also remove the stigma. You know, what I find oftentimes people are embarrassed. And, you know, I remember as a child when my mother would send me shopping with food stamps, because in those days you got the little coupon books.
Yeah.
And I'd look all around, make sure none of my friends were in line when I got in line. You know, it was embarrassing to go to the store and use food stamps. And so I think there's a stigma associated with getting help. And so I think that's one of the other issues that we see oftentimes is even people in Black and brown communities have a stigma with, I don't want to be seen in line getting help or getting food. And so trying to make this experience for people as painful and as stigma-free as possible, I think is important in this work. And then the second piece I'll add to that, and we talked about this in the last webinar, is giving people agency, right? So we're not doing it for them, we're doing it with them. And they feel empowered to not only come and receive, but also to volunteer and to be a part of solving the problem, not just receiving.
Can you say a little bit about the work that you're doing as far as the mobile food pantry?
Sure. So we started in 2013 with our Table of Hope, providing food pantry and soup kitchen throughout the week. But when the pandemic came up, we realized a greater need. And so we had been given a school bus that we turned into a mobile food pantry. And some of the work that we do is we go into different towns, regardless of the demographics, we work with that local town and those demographics to make sure the people from that community are leading the volunteer effort. And I think it makes a real difference because they know their neighbors. They often get in line to go distribute to the seniors who can't get out. So when we go to Dover, which is largely Latino community, we have a huge Latino volunteer corps that comes out. They know the community. They know how to get to the people. We work with Latino churches in that community. And when we go to other towns, we work with the people from those towns who know their community and their people. We work with the local food pantries. So it's, to me, I think it's very important in our work. Last year, we had over 2,000 volunteers that we work with. 20 of them were members of our church. The other 1,980 were members of the community. And so have given them a sense of agency that it's not the church doing it for them, but it's the church doing it with them. And so we say Table of Hope where the community comes to share.
Nice.
Awesome, awesome. How about you, Pastor Luck? What have you learned, know about some of the chronic issues? And particularly, I know that you're doing some work with those who've been recently released.
Yes, I would just add, like with the individuals who are normally chronically food insecure, I'm noticing, especially in a lot of the Black and brown communities, that there are college students who are also food insecure. Some of the students, they had attended public schools where they received the free lunch. And so pretty much after they've been through school, after they graduated, a lot of them go on to college campuses, and some of them may have tuition where they're paying for all their room and board, but still they're finding themselves in a food insecure position. And so in working with individuals in the Department of Health and Human Services, I found myself more so trying to find programs that are surrounded or that aid in food pantries to make sure that they are able to have the access to foods. If they're not qualified or not able to receive assistance through the state, that they are able to receive food through the community agencies, because a lot of the community agencies have other resources, but a lot of them are now starting in and I noticed in the southeastern area for North Carolina, that they are trying to find food security for individuals who may be food insecure or do not have access to foods. I think as Dr. Williams had talked about the mobile pantry, they have also a fresh mobile market that they have, and where a lot of faith-based communities have partnered with Fresh Mobile to sponsor for the community, for families to come out and pick up boxes so that they will have that access to the foods as well. But I have noticed with seniors and especially college students, even individuals who have come out of the foster care system have also been affected as well with food insecurity.
A lot happening, a lot going on. Reverend Thomas, Gina Thomas.
Well, we are working with Jose Andres with the World Food Kitchen, Central Food Kitchen, and many other
Mm.
organizations around the country to ensure that children get all of the food. That's what I'm doing at American Federation of Teachers. And we do lobbying. We're trying to make sure that the legislation is passed, increase SNAP, and make sure that all of those pieces are taken care of. And so we lobby on a daily basis to make sure that not only our teachers, our bus drivers, our nurses, but the students, the patients that they serve are taken care of. And so we spend a lot of time doing that. As the executive pastor at Grant Chapel AME Church in Trenton, we've started a bank where we in fact take food out on Saturdays. We've learned that because of food insecurities, that many organizations, because of the pandemic, without resources. And so on weekends, there are many men and women out on the corners and seniors waiting between when they get their Social Security check or the like. And so we take it to them, to the communities, and spend a lot of time listening. In addition, we have to create an education program to let parents and persons know that once they receive food, that they don't always have to fry it, that they don't always have to be dependent upon a lot of sugar, because those things are expensive. And so if you own a fixed income, it's better off to sort of max out the amount of money and stuff that you can do. And so I think faith leaders, we ought to pick up that too, in addition to other things. And we have to do more lobbying, particularly the AME Church. We are founded out of an activist a basis. And so for some reason, we act like that we only have to stay in church and preach these little sermons we need to get back into the streets and begin to fight at every angle to create relationships with those persons that have taken over our communities and redefine them, whether we're in Detroit, when everything has left. Well, guess what? Then churches ought to come back into that neighborhood. And so we need to, whether we're in Newark or Trenton, or even up in the high-rent district with Dr. Williams, we need to make sure that we are inclusive of all of our communities in order to take this. And when seniors are sitting at home and deciding that they want to take one small can of tuna fish and sort of make it through 2 days, then that's a problem. And and I think as Dr. Jackson said, they're not coming to church listening to a message that we have after going through all of that and trying to figure that out. And so again, lobbying, we have to lobby not only our congressional leaders, but our state leaders, our municipal leaders. We must make sure that our entire congregation, our entire communities are counted in the census, because that is the redistribution of our finances in this government. And so it's important that we connect food insecurities to you failing to do the census, so that we would have enough money to ensure that you get what you want. And so it's up to us. And what we do is connect dots. I connect dots as a pastoral leader. I connect dots in my position at the American Federation of Teachers. We must connect our communities to the things that our communities need.
We said we would come to it a little bit later, but now that you've touched on it, are there other national policy issues that we need to be focused on? You raised an excellent point as it relates to connecting the census, us filling out the census, to our communities receiving the funds necessary to be able to address some of the chronic issues that we're talking about. Are there some other national issues or policies we need to be aware of and need to be active in supporting?
I think we have to register to vote. I think in order to, and that's the reality. Decisions are made by elected leadership or appointed leadership that are appointed by elected leaders. And so in order to make a change, we must participate at every level. And so I think we must make sure that we are counted in the census. We must make sure that we're registered, and not only are we registered, but we must go to the polls and vote your conscience. I'm not I'm not on this call saying Democrat versus Republican. Y'all know I was the Secretary of State of the great state of New Jersey for a Democratic administration. I'm not trying to say, I'm trying to say that we all register and vote whatever our conscience is, and so that we can continue to make a change. And once we do that, then we operate within our sphere of influence within the church and within our community. All too often, our persons are going in one direction, and you ask them about their pastor, they looking about half sideways, which is why all these young people are out in the street, and we as faith leaders are not out there guarding them. We don't have to be, we don't have to be out there with them, but we don't sideline with a Bible and a collar on, talking about if y'all touch them. I'm sorry, Reverend Jackson. I'm getting all off. I'm getting ready to get real straight up political right now. No, I think that we can't just. It's in the Bible. It's in the Bible.
Absolutely.
Yeah.
It's Jerry Falwell that changed his views of what Dr. King was doing once he realized Dr. King was good at it. Then all of a sudden he came back and said, oh, maybe I ought to rethink this preacher political social justice thing. And then they created all of these organizations that then begin to take over sort of in an evangelical, a conservative way. And so I think we need to be conscious of that. And so, Dr. Blunt, my answer is we need to come out of our churches. And I think this pandemic has given us an opportunity to do that. Church ain't stopped, it's just on Zoom now. And so while we're out there, we now need to continue to march and continue to do the things that we need to do, raise the flag for our communities, whether it's crime, whether it's incarceration, whatever it is, we need to raise that issue with those persons who are in charge of it, not just screaming on Sunday, waiting for amen and a song.
Well, I think you just got a whole bunch of amens and hallelujahs out there.
Excuse me. Sydney,
Well,
stop.
and I'm going to put, say that again.
I told Sydney stop laughing at me.
Well, I'm going to turn it over now to Dr. Parker, because I know you were right up her alley.
My chair, I'm telling you, Dr. Cynthia and Dr. Sydney, I'm sorry if we're going to get too familiar in here, but my chair was spinning around. I was so excited when Dr. Regina started talking about lobbying, because all I could think about was lobbying our young people to be a part of this process. Dr. Regina, Dr. Blunt will tell you, I argue, and most times with him successfully, that the church, forgive me for being this blunt, the church is dead. The Black church is dead to most millennials, right? Because of what Dr. Regina said. They want a tangible way to participate in the reformation and the reconstruction of our society right now. And so I think here's, I think Dr. Blunt, you asked a question about federal priorities, but here's my rub. They don't know what the federal legislations are that they should be lobbying for. So when we talk about educating, when we talk about social justice initiatives in and around lobbying our young adults to be participants in this transformation, we got to educate them on what it is we need, right? We can protest, we should, because that keeps the awareness. But at the end of the day, what are they asking for? Yeah. What policies are they asking for those who do go to lobby day or those who do go lobby at the state and federal level? What policies are they asking for them to lobby for? They need to be educated in and around that. I think another thing I would add is our young people in the community, getting them out into the community where they are comfortable, where they want to be, to work with the community around violence and food insecurity. Right? Because there is a connection, working with some of the young people who have been just as involved, working with young people who are homeless, working with young people who are undereducated because of a system that, again, is racially inequitable, and getting them involved in identifying where can this grant money, because I just told Dr. Blunt, there was a neighborhood organization in Chicago that just got a $10 million grant to do some work around the it's called National Emergency Grant. They got $10 million to build out their community to not only address the food insecurity issue, but the violence issue. right? The educational lack of education in the community issue. So while we're getting them all ginned up about voting, we need to get them all ginned up a bit about being consistent, active participants for the long haul, right? And one of the ways we, so you always got to talk about the food depository too. One of the ways we do this food depository is, we have workforce development, right? Poverty is a cause and effect, or has a cause and effect relationship to food insecurity. So if I'm not working, why am I not working? I'm not working because maybe I don't have a skill set. We have something called the Chicago's Community Kitchens. There's a culinary program. We are working with organizations around developing skill sets around working in the warehouse where we do the food distribution. How do we help young men and women get CDLB and CDLA licenses? Because there is a demand for truck drivers out here to get the food where we need to be. So Dr. Regina, I'll be right back.
But I think, Dr. Parker, I'm gonna put a pin in one thing that you said. Yes, they need to be trained, but I am reminded that what God said to Joshua was not do it your way, but do what I told Moses to do. Ain't nothing changed.
No, I agree. Nothing's changed.
When they go to Congress, just ask for what you want and let them draft some legislation on where you are. Let's not make it complicated. Just show up.
I agree.
Hands falling down, or however you gonna show up, and just say whatever is on your mind. I have been a politician. I am a politician. I have worked for too many of them. I'm gonna tell you, we listen to those that are less scripted than we do that are scripted on lobby. So if your church bus, your church van, just show up, get out that car in the state capitol or the city hall, I'm telling you, everybody in that leader's office is going to run to you because they understand that you are from the community. And now you show up with your little suit and tie on, you're going to get some respect. But I'm going to tell you, if you show up in that little church van and everybody get out that little church van and go into that little office, they're going to write down everything you say.
No, I don't disagree. And in fact, I do agree. I don't need you buttoned up. I just need you to show up, right? But what is it you want? Huh?
I like that.
Yeah. So what is it you want to ask for? Just ask for it. But some of them can't really articulate what they want, and that's fine. And what I'm saying is bring us together to help them get out of their system. What is it they want, right? What is it? Well, I don't want to be hungry anymore in Inglewood. That's good. We'll roll with that, right? I'm sick and tired of the gun violence in Auburn Gresham. We'll roll with that. But the young people in these churches have had it, and they want to be out in the community having exactly what you said, a dialogue about how we can coalesce around getting what is needed in the community done. Because, frankly, I've heard enough sermons for a while. What we doing? What we doing, y'all? And speaking from the perspective of someone who works with millennials all day and all night, Dr. Thomas is right, spot on. Yep, they want to do something. They want to hear all that other stuff, right? So that's why I got all ginned up, geeked out, excited, and spinning the chair around and heading to get my suitcase so I can get on a plane and come do whatever it is you asked me to do. I don't know what I'll do it.
But let me just raise this issue, because as faith leaders, it seems like we've lost ground instead of gaining ground. We're dealing with millennials, a number of them who can't read. What happened? Education was important. Voter suppression is on the rise. We're dealing with issues that are getting bigger. What's the faith? Where's the faith leaders? What's the role? What should we be doing to regain? Because you got to lead by example, and it's easy to talk about what the issues are, but where's the church? And we're all affiliated with church in some form or fashion.
Reverend Jackson, I would definitely just chime in. And just what Reverend Regina and Dr. Parker was saying, it is about the education portion. I recently had did what is called the Voters' Right education with my church. And we had did Zoom for several series, and where I took these series back to history voting, how voting came about, how voting affected a lot of African Americans, and even especially for women as well, to have that right to vote. And just taking them through what the three branches of government was. Because I think a lot of people, they don't understand how the government works. And that I think is very key, because especially with when they vote, a lot of offices are important in our cities and our states, knowing that who they're putting in office affects how they live or how their communities look. And so in educating and doing that piece, a lot of people begin to understand, and they said, well, wow, so I vote for the sheriff's office or the sheriff of our city or of our county. So if he is not doing things that are according to such and such, can I actually, make an appointment, talk to them and let them know the concerns and issues in my community? And I said that that's what we will consider like a grassroots movement. And where if there are issues that are stemming in your community that you feel strongly about, and that you are wanting and looking for legislation to help change that, then that's where it's important for us to really start holding leaders accountable who are in those offices, because by us voting them in office, they have a responsibility to the community, because they basically are working on behalf of the people. And I agree with Dr. Regina. I've even expressed that is, with the North Carolina House of Assembly, of going on morning Mondays with Dr. Barber. He goes every Monday to the General House of Assembly, and he does the protest of Moral Mondays. And so with that, those are issues that are now stemming around the Medicaid expansion that he's wanting to see take place in North Carolina, because that's been also a big issue in reference to the food insecurity as well. So that's also a policy that he is looking into legislation to really start expanding, because that's important, especially with the senior population, since they are expanding more. So they're requiring more health care instead of having to make choices between paying for medication versus paying for food to stay alive. So with the education piece, especially about voting rights, the census is also key as well, because the census will help bring the funding that the communities need so that they can have the needs met that the people are needing in that particular community. And so just with talking about that and having that dialogue, a lot of people gained a lot of understanding. So I would definitely say, as faith-based leaders, as pastors, as leadership in the church, we have to take that risk and really step out and start talking and having that conversation with our congregation.
I think one thing Representative Bobby Scott introduced a bill in Congress on July the 30th called the Pandemic Child Hunger Prevention Act. I think each one of our congregations ought to make sure that we call our respective congressional members and making sure that they support that legislation.
Can you name that again?
It is the Pandemic Child Hunger Prevention Act. And it was introduced on July the 30th by Representative Bobby Scott. And so if you go on the congressional website and either put his name up and it'll come up, or type that in, and I can make sure that this chain gets additional information about it, as well as a letter that many of our leaders in NAACP and LULAC and the like signed, that we sent to Congress, mandating that funds stay in, the CARES Act, the HEROES Act, rather, to make sure that children and families are continuing to be fed. And also we have an idea, because a lot of food pantries around the country are losing or not without money. We're also suggesting that, since there are schools already set and many of them have cafeterias and refrigeration and the type, that they become a center part of what's going on. So partner with your schools, and you don't have to worry about the space in your church, because you can maybe store the food in their industrial kitchen. for a lack of a better place to do it. I think, again, as I said earlier, we have to get creative. We have to step outside of our congregations and just look outside of what our concept of church is. We are to make sure that no child is left behind, that no child and no family goes to bed hunger. Then we have to do some crazy. We got to do some crazy, because everyone in our communities are prioritizing priorities. I mean, you're worried about transportation, how to get to work. You're worried about your medication. You're just worried about all of this that's going on in this pandemic. And so you have to focus, and we have to focus them. We have to shed light in these dark places. We must connect these dots when our communities cannot connect these dots.
You know, I would add to what Reverend Thomas said is the learning piece of this with policies is while maybe the community doesn't read the policy to its detail, we as church leaders should, because there are impediments to moving certain things forward. For example, when Dr. Blunt and I were preparing to do the work of distributing the food for the pop-up pantry, one of the requirements for CPAP was that you have the person who is receiving the food sign for the food, right? Otherwise, they couldn't have it. We're in a pandemic. Can we get that waived, right? So if we don't realize that that's an obstacle to just a small thing, but that's why somebody has to read the act or the piece of legislation to its detail, because you miss that small piece, we're not compliant. The federal funds go away. People don't get their food just because of a small little line.
I also can't ditto enough of what y'all have said already, especially what you said, Reverend Thomas, about doing crazy stuff and the need for partnerships and collaboration. The work that we're doing at Arnett Chapel, we're on the south side of Chicago. We're in Morgan Park community. We have about 150 folk on roll, probably about 75 and 80 pre-pandemic would show up on Sunday mornings. And the reality is, by ourselves, we probably could not do the work that we do. It requires going outside our doors. It requires being in collaboration and partnership to really do effective, transformative, social impact kind of ministry in the community that we serve. So we've been grateful for the partnership that we've had with the Greater Chicago Food Depository. It's allowed us to be able to still do ministry even in the midst of the pandemic. We've done a pop-up food distribution where we have served over 300 families every Wednesday for the last 10 weeks. And we're finalizing that at the end of August with the hope of being able to build on that relationship. We have an elementary school right behind our church, and it's their parking lot, because we're landlocked. It's their parking lot that we're using to do the drive-through pop-up distribution. And so we have the elementary school working together and with the church, with the Chicago Food Depository. And then we got our committeeman who is coming and taking food to be able to deliver to seniors who are not able to come to the pop-up. So we got politicians joining in with the work that we got going on as well. And so there are opportunities and ways, if we just step out, to be able to address some of these issues, to address food justice, to address the social impact kind of work we really want to make so that we can do transformative work. And I like Reverend Williams to say some of this stuff, say something to this as well, because your church has done a great job of also building partnerships, as well as want to hear more from Dr. Jackson along those lines as well.
Well, before you start, Dr. Williams, I'd also be interested in hearing from your respective contexts. In Newark, my issue, it was made worse by the pandemic, but it was not caused by the pandemic. When the pandemic is over, the food insecurity issues will still exist. So I'd be interested in hearing from each of you regarding the impact before and during the pandemic as well. Everything has been made worse, no question about it, by the pandemic. But people were hungry way before. The numbers are much higher now, but there's still a systemic problem that needs to be addressed. Okay. Dr. Williams.
Sorry. I'll come back to it in just 2 seconds. Dr. Parker threw something out there which I thought was worth grabbing onto about the $10 million that went out for relief during the pandemic and dealing with violence issues. I guess that was in Chicago. One of the things around this food justice during the pandemic, a lot of money has been allocated to relief, but many of our African-American churches, African-American nonprofits have not got access and not received access to those funds. And so I think one of the challenges is during the pandemic, pre-pandemic, post-pandemic, is how do our organizations actually become self-sustaining? One of the things we've been able to do during the pandemic because of partnerships is we've been able to employ students, college students who are home from college, young people, the ones with the sagging pants and the wave caps. We've been able to employ them, give them jobs, so they are part of the solution. And it's been an exciting opportunity to do that. You're right, Dr. Jackson, this happened before the pandemic, but I think what the pandemic has done, it's what used to be a Black and brown issue or an issue just that poor people were having. Now it's everybody's being affected by it. We have record unemployment numbers. And poverty knows no color. We already knew that before the pandemic, but in this pandemic, it's being reinforced. And so there is money and there are policies being done. I think New Jersey has passed, I want to say it was $15 million for pandemic relief. And then there are a number of funds that have been organized. But I know in Morris County, we're the only African-American led charity that actually received any of the state funds that were allocated to Morris County. And so that's also an issue of food justice, of who gets to participate, who gets to have agency, who gets to organize, who gets to distribute. And I think it matters a lot for Black and brown communities when they see someone like them doing the distribution. And so I pray that after this pandemic and we have resolved back to these chronic issues, that we can still be in the forefront and still have a seat at the table. Before the pandemic, we struggled to get a seat at the table. And we really felt like we had a role to play. We served dinner when the rest of the places were closed. We really focused on being stigma-free, empowering local folks, but we struggled to raise money to keep everything operating. We had to close sometimes because we didn't have money enough to operate. We didn't have money to keep paying people, our cooks, our folks working in the kitchen. And so this pandemic has allowed us to become sustainable and allowed us to raise money so we can pay people, we can pay a driver to drive our bus. So it has been a huge economic boost to our community. But you know, what happens after the pandemic? Will we still have a seat at the table? And so I'd love to see if we get a $10 million grant. That'd be a game changer. In the meantime, we're thankful for what we have received, but 10 million would definitely allow us to train more drivers, train more cooks, and really be a workforce improvement program. We have partnered with workforce improvement. So we've had people that we provided job training to. We've been working with trying to get people who are getting their CDLs. And so we are trying to make this an economic empowerment opportunity as well as a food justice opportunity.
Okay.
Anyone else? How are things pre-pandemic and current?
Pandemic, during the pandemic, yes.
I think we saw on media, CNN and the like, the lines
Yes.
that were into sort of the food banks, and they were driving, and many of our persons pre-pandemic was walking, taking 2 and 3 buses to get to where they have the public transportation, and you could see sort of the difference where food allocations had to close down because they could not sustain it. And so, and I think Dr. Williams is correct, even in his communities, the stigma, but it is because of unemployment. Everybody is working one paycheck from being just broke. And so where you cut short in order to keep a roof over your head is your food. And so you're finding in many places, even in urban communities, we're finding that persons that traditionally go to these places, if they are not there on time, they lose out on what they traditionally get, because those persons now who have transportation, middle class people who just, you know, short on their little paycheck, show up in cars. By the time you done caught 2 buses, done got off your little job, caught you little 2 little buses and get there, you got a big sign on your thing. And so I think that this pandemic has really showed some level of equity amongst our communities when it comes to this issue of food insecurities.
Yes.
Okay. Dr. Parker, you're muted.
Sorry about that. At the food depository before the pandemic, we were able to kind of focus our attention on continuing to strive to end hunger by distributing food with the fresh truck, the fresh truck, our working with our pantries, our soup kitchens, the schools. Overnight, 2 things happened, well, 3 things. Many pantries, because some of the folks who did the work at the pantries were those who are vulnerable to catching the virus, had to walk away from serving the community. So now you have pantries that used to be available to the community having to either close temporarily or they shuttered altogether. So now the demand for food has increased, the access or supply of food has decreased. The food that we were looking to get from grocery stores, because we partner with major chain grocery stores, was limited because people who had access to cars and buses to get in there to buy the food were stockpiling food. Places like Starbucks, for which we do what we call food rescue, which is to take the food that was not sold that day and take it directly to a shelter so that they can have a meal that evening or in that morning. Starbucks wasn't open. So now you have all of these places for where we were able to collect food and share it with the community. They didn't exist anymore. So now what happens? The phone call volume at the food depository doubles and triples within a week because people are, where is the food? How can I locate the food? The pantry isn't there. The schools can't have school lunches because the kids aren't in school. And so that, and then taking on the extra additional work of making sure that our community was enrolled in SNAP benefits. And so that is where we saw the shift. And so for the immediate time, we couldn't focus on public policy as heavily as we were prior to the pandemic, which was solving for hunger. Now we had to really get in, dive in, and deal with the people who were immediately feeling the impact of no access to food. That started in about March, and we're still kind of reeling from it. We still are. So as we even plan other solutions and who we will partner with, we're still dealing with that.
Right, and I know for us, and we've been able in the past to get some assistance, gift cards from supermarkets, and all the supermarkets said, no, we're donating directly to the food bank, so we can't help you anymore.
Yeah.
So a lot of those sources were no longer available. Pastor Kim, pre-pandemic and now.
Definitely, I would say pre-pandemic in Guilford County here was definitely a lack of food shortages and from the pantries. Then when the pandemic hit, it really, a lot of people become unemployed. So I think someone had mentioned with the middle class people who had access to transportation were the pantries prior to those who had lack of transportation, really had a tough time trying to get access to food. Then just allowing and sharing with people about the SNAP benefits at Department of Health and Human Services. I noticed with the pandemic prior into the unemployment, when it went up, there were a lot of families who were applying for services. This was prior to them. Some were able to receive unemployment benefits, but then there were some families who were not able to receive the unemployment benefits due to their employer if they did not pay into that insurance from their jobs. So a lot of that affected a lot of families, and where the food pantries, as Dr. Parker has stated, a lot of places due to the pandemic, a lot of people were either they tested positive, they ended up having to close the place of establishment so that people will remain safe. And then at that same time, we noticed that the increase, that a lot of places were either closing their doors, or the business was just completely gone out of business because they were not able to sustain due to the pandemic. And it was no record as far as when they were going to be opening or either rehiring people at this time. As far as after the pandemic, the one thing that I've noticed, especially with those who are now, when at the end of July, when we noticed that the benefits were not going to be renewed, a lot of families are now having to reapply and try to gain services so that they can feed their households, because now they do not have any resources coming from the state, or have not found employment.
Okay. And I mean, clearly the pandemic has highlighted the extent of the disparity between the communities. The health disparities, the lack of access to food, everything has become magnified. It existed in some places more so than in others, but it existed. But now it's on full display for the whole world to see. So those of us who are involved in food distribution or running food pantries, there's a whole Black Church Food Security Network movement, which promotes community gardens as a way of being able to provide fresh food. What do we see as some practical solutions that we can come up with, that we can offer to people who are dealing with these same issues that we are dealing with? Um, Dr. Thomas, let's start with you.
Rephrase that question again. You lost me right there for a second.
Well, the summary of it
Okay,
is,
yeah.
what are some practical solutions that we could give to people who are going through dealing with populations that are dealing with food insecurity? What can we tell them? What can they do?
I think folk got to, I think we got to be sensitive. You know, I'm from the South. I'm from a little small town, Clinton, Kentucky, one stop, population 300. And they used to say, you know, you look around, it could be us. And I think we have to be giving. I think we have to have the heart of who Jesus is. We have to, I mean, that's the pastoral point of us, but I think that is it. Each one must reach one, and we must do, everyone can't do what we all do, or every church can't do, Dr. Jackson, what your church do. However, they could very well hand you something. They can be responsible making sure that you got some napkins, that you got, you know, some knives and some forks, or that you got a $10 gas card to put in your gas card. So I think we have to let everyone know that every little bit counts, and just walking away assuming that it is not your issue is probably one of the worst things that we can do. And I think we have to listen to some of these people as they come. In addition to food, there are other things that they need, and so we can't just hand them a bag. And I think we have to treat everyone as if what the Bible say, they are our neighbors, they are our brothers and our sisters. And I know every now and then I sound so simplistic, it is boring, but I think it is the basic things such as that that go the greatest way, because people continue to come back because of your attitudes, because of how folk treated them and the like. And then we find that those persons who were receiving food can give food, a year down the road, because they remember that Dr. Sidney showed up with his food truck in a community least subject to nobody would assume that you would go to Morris County, period, with a food truck, unless you just go at his church, in his community where the Black folk live. But the fact that he has expanded it gives us this. And so I think those are the things that we must continue to share with our communities. And again, we have to think outside of the box. We have to do what the founder of the African Methodist Episcopal Church did, the unthinkable. He did not leave Jesus. He did not leave God. He just walked out of the church and continued to do what he had to do. And I think that's what we have to do.
Okay. And the reality is Jesus didn't stay in the church. Jesus wasn't in the church. I don't know where we got that from, but when we look at his ministry, it was not conducted. I think there are a few parables about him being in the synagogue. But the rest of his stuff, he was out in the community dealing with the people.
Went to where they were. And that's what we have to continue to do.
And learn how to meet people where they are, wherever they are.
Pants falling down, hat turned on, smelling bad, out of the prisons, whatever it is, we have to assume. But we also must assume, and I think Dr. Sidney is clear, we can't assume because they dressed up and look good and have a high rent district zip code that they are not facing the exact same issues that those of us in other communities are facing. And this pandemic has not only shown the disparities in attitude, it has also shown where there are these common things that affect each and every one of us.
That's right. That is absolutely right.
Counted in the census.
And the census is important. And just as a suggestion, when we did our food distribution this past Saturday, we also had people doing the census. There was a table set up, and they had, and in Newark, they actually have giveaways because they are really trying to get people to complete the census. And it's amazing how many people would just say, I don't do that. You don't do what? Let me tell you what this is.
You got an iPhone 7 and an 8, you ought to do some of everything, because that's $1,000.
Absolutely.
And you even got it blinged out.
Right. just answer the question. Take all of 3 minutes to do the census, all of 3 minutes.
iPhone 8 and blinged out, and you talking about what you don't do?
Vote. They say they don't vote. Even on top of that.
They don't do that.
They don't vote.
Well, don't do that. Yeah.
Something ain't right about that.
Right.
I'm gonna wait for the next show to tell y'all that.
Well, hopefully this is the beginning of many conversations.
Exactly. Pastor Luck, how about you? What practical examples do you have for us?
I try to look at some things outside of the box, but the only thing that I pretty much found for me that I think would kind of start the conversation was more so, because I'm more of a social services girl. So I pretty much had looked at the administrative side of being able to try to develop an accessible, reliable database of social resources for the community, because there are a lot of community agencies that offer resources that people might not be aware of, and that may be closer to their demographic area, and which can actually be beneficial. And that some places and agencies I found too have been like a one-stop shop for a lot of people. And I found that is definitely a winner for a lot of people, because with the lack of transportation, not being able to get back and forth, being able to go to those agencies and be able to get their needs met, majority at least, has been beneficial to a lot of people. And then implementing that, if that particular agency does not have that particular resource, just learning to refer out to other agencies that will be able to assist with those families. And then providing sources of navigation. I think someone had mentioned too, being that resource, not just only walking them to the agency, but helping them walk through so that they can better understand what the assistance that they provide, and then also being able to volunteer later on, because I volunteer for a women's resource center that is in Greensboro. And so with the resources that are available, a lot of women who have come in for assistance turn around. Half of the ones that came in turned around and became actual people who work as volunteers there and helped other women as they came into the center, and they were able to share their story and be able to also offer them the resources available within the community. So I think also with that, being that navigation person, reducing and removing the language barriers and culture barriers. I think that that was definitely key with being that resource to taking those practical steps, because especially in our communities, we have a lot of people who are who have cultural barriers, language barriers, and to where they may sometimes feel ashamed, or they may not know how to actually reach out to ask for assistance. But if the agencies, or if the community agencies are able to meet them at that barrier, or able to help them with the cultural barrier difference, then they are able to also get access to the resources that are within the community that can actually help their families. And then last but not least, addressing the social determinants of healthcare that can be interconnected with food insecurity, such as the housing and the transportation. This piece can be that when we are helping them navigate through the resources, that we're also able to have them in that one-stop shop mode to also address if they may have housing issues, transportation, or either to help assist them with employment opportunities so that they can be able to assist and help out their families.
And that's a good point, because the reality is, even if you are not one doing the services, you can put together a list of resources of people in your community that are
Absolutely.
providing the services, so that you know where to send people to. Everybody doesn't have to do everything. So that
Absolutely.
is excellent. And to Dr. Thomas's point, sometimes it's about listening to people, not just handing them a bag or a box of food. Like 3 questions away from finding out they lost their housing, they don't have no place to stay, they don't have no place to cook the food that you just gave them.
Right.
Um, they just go and playing it, whatever comes along comes along. So just being
Right.
able to listen, to understand, and try to assist where you can. But
Yeah,
knowing where the resources are goes a very long way.
yeah, and can
Dr.
I can
Oh,
I ditto the navigation piece, and this kind of goes back to Dr. Thomas and Dr. Parker's conversation about our work with the millennials. Um, the resources may be there, but knowing how to navigate the systems to be able to access the resources
Mhm.
is an important key. And not everybody doesn't know how to navigate the systems to be able to get access to what they need. And so we do need navigators in our faith communities, navigators, folk who have either through their own trial and error, or they've worked in that system before, who can help others navigate the system to be able to take advantage of what's available and have access to it.
If I could add to that, Dr. Blunt, about navigation, I'm going to tag something that Dr. Gina said, crazy partners. I use this phrase when we were introduced Table Up to our church. The disciples are trying to tell Jesus it was too many people to feed, that, you know, we don't have enough money in the budget, need to send them home, get their own food. The reality is, many of our churches talk about what's in the budget and what we can't do, and all that we can't, you know, we can't do that. It's too many. And when we started, we declared we were going to do this Monday through Friday. And the response was, we didn't have the budget, we didn't have the people, we didn't have the resources. But because we had a big vision, people were coming from outside of the church to volunteer. And when we got the bus, I remember one member said, Pastor, now you're not going too far. Ain't nobody getting on that bus, and we don't have money for the bus. And I said, we didn't buy the bus was given to us. And if God gave us the bus, God will make a way. And the reality is, the crazy partnerships that we've been able to secure over these past 18 months has what has sustained the bus. But not only that, when it started getting hot, we needed a refrigerated vehicle. And so people said, well, you're gonna have to cut back. You can't do meat, you can't do dairy because you don't have a refrigerated vehicle. And I said, no, we got to think bigger. And we were able to get a $50,000 gift so we can go buy a brand new refrigerated bus. So my word of encouragement is think bigger, think about crazy partnerships, think about the partnerships of people that maybe not share your faith, may never join your church, but care about the mission you're trying to do. And if your vision is big enough and your tent is big enough, that you may find that the neighborhood liquor store may just want to be your partner. Amen. You know, we've had a couple bars write us some checks. Amen. All things come of thy ill, Lord.
But when you're in the community, there are a number of liquor stores very close to where the churches are. And if you stand outside, some of your members probably stop it
We have
in
some
the store on their
bar
way
owners
home.
that have been very helpful to our ministry and to our work. So if they're listening tonight, thank you for your support.
I would even go, keeping with the theme of going bigger. I used to work for a wine and spirits distribution organization, and they are ones who, when we have one of our big fundraisers, they are the first ones I go to and say, I need some of that wine, I need some of that spirits. We're auctioning it off at this fundraiser. I need y'all to buy 2 tables. They think nothing of it. It is just another thing on the P&L for them. And they are willing when they know that what the cause is for, right? So I don't think so in keeping Dr. Williams with thinking big, we can tap on the shoulder of our neighborhood liquor stores, but let's go to the supplier. Let's go to Moet Hennessy. Let's go to Bacardi for those who go to those places, right? Yeah, and when we can tell them what our vision is for the community, whether they do it out of altruistic reasons or because they have a social responsibility part of their strategy to do so, they'll open up their pockets. But I want to kind of build on that, in keeping with Reverend Regina's thinking, do the drastic, which I love. I think I'm going to steal that, but I'll give you credit. Do the drastic. Millennials are tech savvy, data savvy, social media savvy, period, right? So, and if we go and talk with them in their communities and say, what is it that you need? And we really listen, they have the ideas, they have the resources. We'll get that stuff done before you can even go to bed at night, right? But I would also say, because we do this, we've done this in some regards, wherever you are, I'm sure there's a local college, university, and there are faculty members, there are students who desire to partner with the community to do things like do the data analytics to say, okay, we heard from the community and they said they need this here. They can go back and do the data around that so that you are informed about specifically what you need. So then when you ask for the money for it, because let's just face it, the people who have the open wallets, they're not as concerned as we are about what the community says. But if you can give them data and say, this is what the data says, they're like, oh, that's interesting. I didn't know that. And so bringing those two radically different dichotomous kind of relationships together can also help, just speaking as somebody who kind of traffics in the business school.
And Dr. Parker, given your love for the church, That's an inside joke between her and I. What practical things would you offer for congregations to begin doing?
Yeah, I think it's just one thing at a time. Identify the one thing. If it's you want to do the pop-up, I tell you, when we started that pop-up, we had cars kind of sporadically lining up, and we had a few volunteers. We asked them to sign up because we wanted to be sure that we would have the volunteers. Week 10, I don't even ask who the volunteers are going to be because they consistently show up every week, because people at their core really do want to serve. They really do want to do something of value. Start with the small thing, whatever that one small thing is. Once this pop-up is over, if we decide that we're going to partner with a pantry, do a soup kitchen, now we got the volunteers engaged from our church. They're going to be asking us, hey, what's next? What are we going to do next? Start with the one thing, whatever it is your congregation and community, and don't look around for the other church to do it. Dr. Blunt and I talk when we're standing there doling out, produce, asking, where are the other churches? It doesn't really matter. There's enough work for everybody. There's enough work for everybody. I'd say start with the one small thing.
Right, and it's not a competition.
Correct.
There
Exactly
is
right.
absolutely enough work, enough need to go around, and then some.
Yep.
When we started our pantry at Allen, it's called the Allen Village Food Pantry. It's 4 years old now. We started with members just donating cans of food because there was a need in the community. And because the vision was so much bigger than that, I mean, now it's a blessing when the truck from the food bank pulls up, and they're unloading pallets of food. And that the people standing in line waiting to be served will help unload the pallets of food. It's a community effort, but you have to start someplace, and you have to learn to ignore those voices that tell you you can't do it. We've never done it like that before. I don't know where you think you are, because God can do all things, and if He gives you that vision, He's gonna help you figure out how you carry that vision out. Right.
Wow.
Man.
So, my friends, thank you all for sharing with us today. This has been tremendous. A lot of great information, a lot of great conversation has been offered. And I pray that it has been a blessing to those who have joined in with us and listened. Before we break, Sydney, are there any questions that emerged that we might want to address quickly?
There were no questions that came in on the chat, but there were some comments. One person talked about she's a former mayor of Lithonia, Georgia, and she started a farmer's market. And I understand that the farmer's market has continued and done well. And if I'm reading this right, I think she partnered with the local farmers, I think African-American farmers. Yeah.
Okay, in the act of full disclosure, that's my sister.
Okay.
Awesome.
Hey.
Deborah Jackson.
All right.
That's
And
all
she
right.
was the mayor for 8 years in Lithonia, Georgia. Yes, and they did an awesome job. Small town outside of Atlanta.
Well, I used to live near Lithonia, so I know the area well.
Okay.
Great work. Any other comments that you want to lift up?
No, this has been great.
All right. Well, before we close, Sydney, why don't you share about the upcoming webinar that we're going to have?
Yeah, so the next one, September 10th, we're looking at faith and philanthropy. Coming back to the comment by Dr. Parker, where are the philanthropists? Where are the foundations? How do we access those resources? Many of the people in the foundation community shy away from churches because they think we're really focused on proselytizing. But one of the things Dr. Blunt and I have been talking about, the Black church has always been focused on social impact and community improvement. And so how does the Black church then sort of create the narrative that where we can work with foundations and foundations will want to work with us? Next month, we'll have Dr. Ivor Carruthers from the Samuel DeWitt Proctor Conference, Elizabeth Lynn from Lake Institute, which is funded by the Lilly Endowment, Bishop Frank Madison Reed, who actually participated in one of the documents on the Black church and philanthropy. And we have Anthony Bug-Levine, who is the CEO of the Nonprofit Finance Fund. And so I think it's gonna be a great conversation. And how do we begin this conversation? We can access the resources to do the work that we've been talking about tonight and the other aspects of the work we're doing. And so we want to encourage you and invite you to be with us the second Thursday of September, September 10th, for our next webinar. Thank you, Dr.
And
Clark.
can I just make one final point? I saw in the comments, someone said a lot of small churches don't have 501c3s, and that's true. Ask a lawyer to do one for you. All they can do is say yes or no. Just ask. It's not that complicated to get it done. It's not even that expensive to get it done. If that's what you're lacking, just ask. You'll never know if you don't put yourself out there. Thank you.
And to that point, if by chance you're near a school that has a law school, they may have a group of folk that would be able to do that pro bono for you.
Absolutely. Absolutely.
But even then, I would go back to Dr. Parker's point. Don't allow that to keep you from doing at least that one small thing to get stuff going and making a major impact within your community.
Just
Thank you.
do it.
Just do it.
Just do
Thank you, Dr. Parker. Thank you, Pastor Luck. Thank you, Dr. Thomas. And thank you, Dr. Jackson, for being an awesome co-host.
Thank you.
Thank you, Dr. Williams, as we continue to lead the Oikos Institute for Social Impact. God bless all of you who have been able to be on with us, and look forward to future webinars that talks about how we can begin to make a truly major transformative social impact in the communities that we serve. God bless you all.
Thank you.
Thank you.
Good night.
Good night.
Good night.